At the state capitol this afternoon, the Hawaii Health Systems Corporation went before the Senate Ways and Means Committee to talk about funding. HHSC is a safety net for Neighbor Island care, so that means its hospitals care for patients even if they don't have health insurance or can't afford to pay. The community hospitals depend on state money appropriated by the legislature to continue to operate. And some of the HHSC hospitals include Maui Memorial Medical Center, Lanai Community Hospital, Kauai Veterans Memorial Hospital, Maluhia and Leahi Hospital on Oahu, and Hilo Medical Center and Kona Community Hospital on the Big Island. And joining us now is the CEO of Kona Community Hospital, Clayton McGhan. And thanks so much for being here with us this afternoon.
Thanks, Marissa, for having me.
Thank you. And if you could just explain some background information about Kona Community Hospital, how critical is it for that side of the island? And also, how many people do you service every year?
Absolutely. So Kona Community Hospital is extremely critical for the west side. We currently see about 20,000 patients a year through our emergency department. We're a 94-bed acute care hospital, so we see, like you said, everyone.
Wow, very important. And your hospital is requesting almost $20 million over the next 2 years from the state lawmakers. So what would that money be used for?
That money would be used for critical infrastructure needs. Currently, we have several items that are risk of closure, and we want to make sure that we can continue to deliver the care that we need to, that the community deserves.
What are some of those things that you folks need to repair or fix? And if you don't do that, how will it affect patient care, or will it affect patient care?
Great question. I can tell you currently we deliver cancer care to many of our patients, and we're looking to seek to gain funding for our pharmacy expansion, which will allow us to meet the regulatory requirements to deliver the drugs necessary so patients can continue to receive that care.
Okay, anything else that you folks are looking to use that money for?
Yes, so we also have many of our critical systems, for example, our HVAC system, which helps ensure that the operating rooms are climatized. And if that failed tomorrow, we would have no ability to deliver operating room services, and patients would have to be transferred to other islands.
Wow, that's huge.
Yeah, it is.
All right, you were here for opening day of the state legislature, and you've also been meeting with some of the lawmakers. How have those conversations been going?
They've been quite positive, and I think that they understand the critical need, and we're hopeful that they will continue to support us in our efforts and our community.
Okay, great. Thank you so much. The CEO of Kona Community Hospital, Clayton McGhan. Thanks so much for joining us.
Thank you. Pleasure.
Over to you, Mika.